Bismillahirrahmanirrahim. Today our lecture is on treatment of rheumatoid arthritis. Rheumatoid arthritis is a disease which affects the joints, and it is autoimmune in nature. As far as pharmacology is concerned, we should understand what is the pathogenesis of rheumatoid arthritis and what are the drugs which either delayed or stop the process of destruction. अगर राहिल एक मिनट आइए. So rheumatoid arthritis is a disease which autoimmune in nature, means when your immunity works against your tissues. So the drugs which are used in rheumatoid arthritis starts from the NSAIDs and going up to the disease modifying anti-rheumatic drugs. Means the drugs which modify the disease, they are called DMARDS. What is immunity? This is the response of the human body towards all types of organisms or any type of toxin which have the ability to damage the tissues. This is called immunity. And what is autoimmunity? Immunity is against the injurious agents which have entered in the body. But when the immunity causes destruction of the own tissues which are not antigenic, normally the disease is called autoimmunity. Your immune system that launches a specific immune response against normal constitutes of the body. This is called autoimmunity. And rheumatoid arthritis is a disease which autoimmune in nature. Autoimmunity, maybe it affects a single organ like Graves' disease, which affects the thyroid gland, and myasthenia gravis, which affects the skeletal muscles. And it may be cause the destruction in systems like systemic lupus erythematosus and rheumatoid arthritis. Rheumatoid arthritis is a disease of joints and connective tissues in which immunity of the person causes destruction in the joints and connective tissue. Now, the definition of rheumatoid arthritis is a chronic systemic inflammatory disease, autoimmune and inflammatory. And inflammation is chronic type, means this is not acute inflammation, but this is the disease which chronic in nature and affects the joints, but they especially affects the small joints. Along with this, it can affect other tissues other than the joints. So rheumatoid arthritis is a chronic systemic inflammatory disease. Means there is an inflammation, chronic type of inflammation. This disease is predominant in females. So ratio is 3 into 1 female ratio, male ratio. This disease is caused by autoimmune response against an unknown self-antigen, means not specific type of antigen. This unknown antigen against which your immune system causes the destruction. As this disease is chronic in nature, so there is the T cell reaction. And T cell reaction causes the production of the B cells, and T and B cell both causes the production of the cytokines. Cytokines are the substances which attract the next generation of the T or B cells and which activate the phagocytosis. And when there is the phagocytosis, there is the damage to the tissues. And when there is the damage, your normal response of the tissue is to get proliferate. So this type of disease causes the production of T cell, B cell trees, production of the cytokines, and when there is T cell, B cell, and cytokines, that leads to the destruction to the tissues. That is called the phagocytosis, and that tissue damage results in the repair of the damage. So they causes the overstimulation of the proliferative phase of the synovial cells. And in this response, there is the destruction of the joints. So rheumatoid arthritis is the disease which is chronic in nature. It affects the small joints especially, but may affect any tissue in the body along with the joints, and it is chronic type of disease in which chronic inflammatory changes are occurs. When there is the chronic changes occur, their result is over proliferation of the cells. The cytokines, tumor necrotic factors, they play the central role in the pathogenesis of the rheumatoid arthritis, and antibodies may also contribute to the disease because there is the antigen antibody reaction. Now, the treatment of the rheumatoid arthritis means the pharmacological agents which are used to treat the rheumatoid arthritis. They start from the non-steroidal anti-inflammatory drugs, which are known as NSAIDs. These are non-steroidal in nature and they causes anti-inflammatory responses. Then steroids, corticosteroids, they are also anti-inflammatory in nature, and the gold salts. Then there are some drugs which are called disease modifying drugs. They are synthetic or biological. Synthetic means they are synthesized in the laboratories like METHOTREXATE, SULFASALAZINE, leflunomide, and anti-malarial drugs. And biological DMARDs, they are ABATACEPT, rituximab, tumor necrosis factor inhibitors. So this is the classification of the drugs which are used to treat the rheumatoid arthritis. NSAIDs, steroids, they are discussing in separate chapter. We are concerning disease modifying anti-rheumatic drugs. Number one is the methotrexate. Methotrexate is the drug which causes inhibition of the three enzymes, the dihydrofolate reductase, aminoimidazole carboxamide, ribonucleotide transformylase, and thiamidylate synthetase. These are the three enzymes which are blocked with the administration of the methotrexate. This is the mechanism of action of methotrexate. Means methotrexate is the inhibitory to these three enzymes. So they are called folate antagonist. This drug also affects the polymorphonuclear chemotaxis, means they inhibit the migration of the polymorphonuclear cells towards the site of injury, and they directly inhibit the proliferation. As I have told you, in rheumatoid arthritis, first there is the destruction, and that destruction is by nature treated by the proliferation. So this drug inhibit the migration of the cells, and along with this, it also inhibit the proliferation of the synovial joints. And this is also inhibition. This is also caused the inhibition of cytokines. When there is no cytokines, there is no chemotaxis. When there is no chemotaxis, there is no cells in the injurious site. So, methotrexate is the drug which causes the inhibition of three enzymes: dihydrofolate reductase, aminoimidazole carboxamide tribonucleotide transformase, thiamidylate synthetase. And along with the inhibition of these enzymes, it also affects the polymorphonuclear chemotaxis, proliferation, and the cytokines inhibition. This is the mechanism of action of methotrexate, and this drug is first drug in disease-modifying anti-rheumatic drugs. Then the pharmacokinetic of methotrexate. Methotrexate is the drug which is taken through the oral route of administration, and this is metabolized to less active hydroxylated metabolite, and its half-life is 6 to 9 hours. When this drug, methotrexate, is given along with the hydroxychloroquine reduces the clearance of methotrexate. Methotrexate is excreted through the kidney. When given with the hydroxychloroquine, there is the increased tubular reabsorption of the methotrexate, means the clearance of the methotrexate is going down, and accumulation inside the body is enhances. So this is the drug interaction of methotrexate with the hydroxychloroquine, and the primary excretion side of the methotrexate is kidneys. This is the pharmacokinetic, means how this drug is taken, how it gets metabolized in your body, and what are the drug reactions, drug reaction, and from where it is excreted out. When you given the methotrexate to the patient, the various side effects are noted, like nausea, mucosal ulcers, and this drug should not be given in the pregnancy. Now the indication, means in which condition methotrexate is indicated to the patients. They are juvenile chronic arthritis, psoriasis, psoriatic arthritis, ankylosing spondylitis, dermatomyositis, polymyositis, Wegener's granulomatosis, and giant cell arthritis, vasculitis, and systemic lupus erythematosus. These are the indications of methotrexate along with rheumatoid arthritis. The dose of methotrexate in rheumatoid arthritis is 15 to 25 milligram per week. ABATACEPT. This drug is called co-stimulation modulators. And co-stimulation modulator, they inhibit the activation of the T cells because T cell play a key role in the genesis of the rheumatoid arthritis, and this drug is given by the intravenous route of administration, and the schedule of ABATACEPT is day 0, after 2 weeks, and after 4 weeks. Then there is the monthly infusions of this drug. Dose patient weights below 60 kg 500 milligram, 60 to 100 kg 750 milligram, and more than 100 kg 1000 milligram. This drug given through the intravenous route of administration, and day 0, a interval of 2 weeks, the interval of 4 weeks. And after 4 weeks, this drug is given monthly infusions. ABATACEPT. The adverse effects: increased risks of infection of upper respiratory tract, and this drug should not be given with tumor necrotic factor alpha antagonist. Then the azathioprine. Azathioprine act through its major metabolites, means this is the prodrug. It first converted into a metabolite, then it will produce its effects. 6-thioguanine. 6-thioguanine, what it causes? It causes decreased secretion of interleukin 2, decreased synthesis of inosinic acid, and decreased functional ability of beta and T cells. And they also causes the suppression of immunoglobulin production. The indication of azathioprine: rheumatoid arthritis, psoriatic arthritis, reactive arthritis, polymyositis, systemic lupus erythematosus, Behçet's disease. These are the indication of azathioprine. This drug causes bone marrow suppression. These are the adverse effects of azathioprine. Gastrointestinal disturbances, and it also causes increased risk of infections. Then chloroquine and hydroxychloroquine. This is also belong to the disease-modifying anti-rheumatic drugs, and chloroquine and hydroxychloroquine, it causes the T cell response decline, decreases leukocyte chemotaxis, means T cell movement towards the injury site, and it also stabilizes the lysosomal enzyme. Lysosomal enzyme should not become at the site of infection, and this drug also causes the inhibition of DNA and RNA synthesis and trapping of the free radicals. Free radicals are responsible for the destruction of the tissues. So this drug produce its effects by decreasing the T lymphocytic response, by decreasing the movement of the leukocyte, it is called chemotaxis, and it also stabilizes the lysosome, so decrease the lysosomal enzyme induction at the site of infection, site of injury, and inhibition of DNA and RNA synthesis. This drug also causes trapping of the free radicals. This is the mechanism 5 Major role of chloroquine and hydroxychloroquine in the anti-rheumatic phenomenon. Chloroquine and hydroxychloroquine, they get rapidly absorbed when they are given through the oral route of administration. When it reaches into the circulation, this drug 50% bounded with the plasma proteins, and this also have extensive activity to bound with the tissues, and its half-life is up to 45 days. This is the pharmacokinetic of chloroquine, and hydroxychloroquine is disease-modifying agent in rheumatoid arthritis. The chloroquine and hydroxychloroquine have the side effects like ocular toxicity, increased production of hydrochloric acid or dyspepsia, nausea, vomiting, and abdominal pain. These are the side effects of the chloroquine and hydroxychloroquine in the treatment cyclosporine. This is the gene transcriptase, acts through the gene transcription. It inhibits interleukin 1 and 2 receptor productions. Means receptor production is blocked by the administration of the cyclosporine. Gene transcription. It causes gene transcription. So the receptor production will be inhibited. They also inhibit macrophages, T cell interaction, and with the responsiveness. Cyclosporine. What is the mechanism of action? They act through the gene transcription. So they inhibit the formation of interleukin 1 and 2 receptors. They also inhibit the macrophages and T cell interaction and their responsiveness. Cyclosporine. The side effects of cyclosporine, they are nephrotoxic, can cause hypertension, increased level of potassium in the blood. It is called hyperkalemia. This drug is also toxic to the hepatocytes, so they causes hepatotoxicity. Gingival hyperplasia means excessive growth of gums tissue. Hirsutism means excessive growth of the hairs other than the normal size. These are the side effects of cyclosporine. Cyclosporine is a gene transcription inhibitor, and it causes the inhibition of interleukin 1 and 2 receptors, and also inhibit macrophages and T cell interaction and their responsiveness. This drug has side effects like nephrotoxicity, hepatotoxicity, hypertension, hyperkalemia. These are gingival hyperplasia and hirsutism. And this drug interaction with diltiazem and potassium sparing diuretics. Then the sulfasalazine. Sulfasalazine acts through its metabolites like sulfapyridine and 5-aminosalicylic acid. Sulfapyridine is having an anti-folate action, and in response of this anti-folate action, immunoglobulin A and immunoglobulin M, they also gets decreased. The response of the T cell towards the disease is also declined. inhibition of B cell proliferation, and this drug causes various interleukins inhibition like interleukin 1, 6, 12, and tumor necrotic factor alpha. Sulfasalazine acts through its metabolite, sulfapyridine and 5-amino salicylic acid. Sulfapyridine and 5-amino salicylic acid, these two metabolites have a function that it has decreased folate production, means they are folate antagonists. They cause decreased formation of immunoglobulin A, immunoglobulin M, and also suppresses the T cell response. They also causes inhibition of B cell proliferation, and along with this, inflammatory cytokines also inhibited like 1, interleukin 1, interleukin 6, interleukin 12, and tumor necrotic factor. This is all about the mechanism of action of sulfasalazine. The pharmacokinetic of sulfasalazine is 10 to 20% of these drugs gets absorbed after oral administration. Its absorption can be decreased due to the intestinal bacteria. Sulfapyridine absorbed and excreted after hepatic acetylation and phosphorylation. Means the route of excretion is hepatic. The route of administration is oral. And this drug acts through its metabolites. The common side effects or adverse effects, they include like nausea, vomiting, headache, and along with this, rash and hemolytic anemia. These are the side effects of sulfasalazine. Now, tumor necrotic factor alpha blocking agents means the agents which have the ability to block the tumor necrotic factor alpha. Tumor necrotic factor alpha affects cellular function by activation of a specific membrane-bound tumor necrotic receptor. Tumor necrotic factor receptors R1 and R2. These drugs interfere means that it comes in between the tumor necrotic factor alpha used for the rheumatoid arthritis. And these drugs are adalimumab, infliximab, and ETANERCEPT. These drugs are tumor necrotic factor alpha blocking agents. Adalimumab. Adalimumab is fully human immunoglobulin G1, anti-tumor necrotic factor antibody, and it complexes with soluble tumor necrotic factor alpha. When it form a bond with this tumor necrotic factor alpha, so it prevents the interaction of P55 and P75 cell surface receptors. When these receptors interaction is prevented, so there is result in down regulation of macrophages and T cells. The pharmacokinetic of adalimumab, this used subcutaneously means parenteral route of administration, and its half-life is 10 to 20 days. Its clearance and formation of human anti-monoclonal antibody is decreased in the presence of methotrexate. When you give this drug with the methotrexate, the drug-drug interaction is there. Its clearance and formation it decreased. Infliximab. Infliximab is a chymeric 25% mouse and 75% human immunity. Immunoglobulin monoclonal antibody. This binds with the soluble and possible membrane-bound tumor necrotic factor alpha. The mechanism of infliximab is same as the adalimumab, and this also has parenteral route of administration. The difference is that it can be used with the methotrexate. But in case of adalimumab, the methotrexate decreases the clearance. ETANERCEPT, it is a recombinant fusion protein consisting of two soluble tumor necrotic factor P75 receptor moieties linked to the Fc portion of the human immunoglobulin 1. So it binds with tumor necrotic factor alpha molecule and also inhibits lymphotoxin alpha. Used subcutaneously and its administration is twice weekly. These three tumor necrotic factor alpha blocking agents, their indications are rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, Crohn's disease, psoriasis, ulcerative colitis, juvenile chronic arthritis, Wegener's granulomatosis, giant cell arthritis, and sarcoidosis. All these diseases are autoimmune in nature. So these tumor necrotic factor alpha blocking agents, they are active in these indications. The side effects of tumor necrotic factor alpha blocking agents, there is the increased chance of bacterial infection because there they are inhibition because it's inhibition of immunity, and when they given to patients who have tuberculosis because of the activation of latent tuberculosis. These drugs causes leukopenia, means decreased WBC count in the blood. These drugs cause hepatitis and activation of hepatitis, and along with this, vasculitis. The side effects of tumor necrotic factor alpha blocking agents is they inhibit the immunity, so there is a chances of bacterial infection and latent tuberculosis activation, decreased leukopenia, hepatitis, activation of hepatitis, and the vasculitis. The glucocorticoids, cortisol, prednisolone, betamethasone, triacinolone. These are the drugs which are steroid in nature. And steroids causes decreased T and B cell production. They suppress the production of cytokines because they suppress the T cell and B cell generation. Inhibition of macrophages function, inhibition of production of prostaglandins and the leukotrienes, reduce the expression of cyclophosphamide 2, and along with this, these drugs causes vasoconstriction by suppressing the mast cell degranulation. As there is a vasoconstriction, there is a decreased capillary permeability by reducing the histamine. So all these things contributed in the decreased response of the white blood cells or immunological system, which is against the own tissues in case of rheumatoid. So when you decrease the production of T and B cell, when there is a decreased T and B cell, there is a decreased cytokines. When there is decreased cytokines, there is decreased chemotaxis. So the macrophages cannot reach at the site of injury. And when they also inhibit the various prostaglandins and leukotrienes which are chemoactive in nature. And along with this, they causes the vasoconstriction, and when there is the vasoconstriction, there is the decreased capillary permeability. So there is a decreased production of the cells and chemoprotective factors. These are the glucocorticoids drugs. They are steroid in nature. Glucocorticoid drugs, cortisol, prednisolone, betamethasone, triacinolone. As I told you, these drugs are anti-inflammatory in nature, and rheumatoid arthritis is a chronic inflammatory condition. So, to delay the process of pathogenesis of the disease or to stop the pathogenesis of the disease, these drugs have a vital role. The side effects of glucocorticoids, the insomnia, euphoria. Insomnia means decreased sleep. Euphoria means the feelings of something better. Increased intracranial pressure. Because these drugs causes a steroid in nature, so they have the ability to increase the intracranial. They suppress the release of adrenocorticothyroid hormone, growth hormone, and thyroid stimulating hormone. When the glucocorticoid drugs are given to the patients, there is the more chances of peptic ulcer. And there is the excessive fat distribution in the supraventricular area. Means this drug results in overweight. Important effect on the hemopoietic system. Then the gold salts. These salts modify the cellular or humoral immune response. They have the ability to modify the cellular or humoral immune response. Their mode of action is not properly understood. Means you can't exactly like other drugs, you can't elaborate that this is the mechanism of action and this one. Unclear mechanism. But it was uh, it was thought that this is there is a decreased formation of arocyanide in area of inflammation. So gold salts are also used in rheumatoid arthritis. Sodium aurothiomylate for deep injection and arenophin for oral use. Means this drug, these gold salts can be given through the parenteral route of administration, and along with the parenteral route of administration, they can be given through the oral route of administration. And their mechanism is not clear, but it was thought that they cause the formation of arocyanide in the area of inflammation. The adverse effects of gold salts are pruritus, dermatitis, glossitis, leukopenia, means decreased WBCs, marrow failure, thrombocytopenia, hepatitis, renal damage, peripheral neuritis, and encephalopathy. These are the adverse effects of the gold standard. This is all about the rheumatoid arthritis. If you have any question, you can ask. इसको एक अनम्यूट कर दें और चेक क्वेश्चन आंसर जी एनी क्वेश्चन
यस मैम
जी बेटा
मैम आपने गोल्ड सॉल्ट में बताया कि ऑरोसाइनाइड की फॉर्मेशन करता है एट द साइट ऑफ इन्फ्लेमेशन, तो उसका फंक्शन क्या होगा?
Cyanides are very toxic, so it causes the destruction of the cells which are overgrowth, like proliferation of the cells of cyanide glands. Okay.
ओके मैम।
Other question?
और मैम ग्लूकोकॉर्टिकॉइड ड्रग्स में आपने एक पॉइंट बताया था कि वेसोकंस्ट्रिक्शन बाय मास्ट सेल डीग्रेनुलेशन, इसका दोबारा से बता दें।
When there is a vasoconstriction, there is no skipping of the plasma cells like T cells or B cells, and these cells are responsible for the formation of antigen antibody reactions. So when there is no antigen antibody reaction, the mast cell deposition is inhibited, and mast cells are responsible for the production of the cytokines. So in this case, there is a decreased production of the cytokines, or when there is decreased production of the cytokines, there is a decreased immune response towards the destructive agents.
थैंक यू मैम।
Any other question, beta? All is clear? Hello? एक मिनट बात सुनेंगे?